Hey everyone, I'm Raj Kumar, President and Editor-in-Chief of DevX. Delighted to be with everyone who is joining us for this conversation, and especially with my friends and colleagues who you see on the screen here. I want to tell you who they are and tell you what we're here to talk about just very briefly. This is a video conversation where we're trying to have an announcement about something pretty exciting that's going on between DevX and Panorama related to our journalism on the COVID-19 crisis. We're going to get to that in a few minutes, but I want to first get into a discussion about what's happening with the pandemic today, particularly in the global south and in low and middle income countries. And to do that, we've got these fantastic leaders and experts on this call. We're going to have a great roundtable conversation, and then we're going to come to you with this announcement. I want to first welcome Gabrielle Fitzgerald, who is the CEO of Panorama, which is an action tank based in Seattle. Gabrielle is a leader in the global health community. She is the brains behind a lot of really exciting initiatives in global health that utilize collaborative philanthropy, bring together unlikely partners, and work on all kinds of issues, including things like Ebola. So we're gonna get into that in a second. Gabrielle, thank you so much for being part of this today.
Glad to be here.
And joined as well by Amruta Bietnal, who is an associate editor at DevX, based in India, and has really been leading a lot of our coverage on the pandemic. And so I'm excited to hear a little bit more from you today. Welcome, Amruta.
Thank you, Raj. I'm excited to be here.
And then Jenny Lee Ravello, who hopefully you recognize her byline. She is a global health reporter at DevX, a senior reporter who's got a lot of experience covering global health, particularly the WHO. She's based in the Philippines, but covers these issues really all over the world. So Jenny, really excited to have you join the discussion as well.
Thank you for having me, Raj.
I'd just love to get a sense from all of you of what are the stories and issues that you're paying attention to, particularly when it comes to low and middle income countries, when it comes to places like Africa, Southeast Asia, and Latin America. Where do you see the moment that we're in now when it comes to the pandemic? What are some of the things you're paying attention to? Maybe Gabrielle, I can start with you.
Thanks, Raj. Well, let me start at a global level and then leave it to my colleagues to speak about the regions that they're most familiar with. But from what I see globally is the world is really still grappling with what COVID is. And this isn't just an illness that you have and you recover from. That happens to some people, but there are some very long-term effects that we're beginning to see where people are still struggling months later to get better and return to their full health. And so we don't have any idea what the long-term consequences of this disease are. So I'm sorry to start on a little bit of a tough note, but I think there's still more to come on this.
Yeah, I agree with you. And I think there's probably some more tough notes to come in the conversation, because part of the issue is not only the health effects, but particularly when you think of low and middle income countries, the economic repercussions, the livelihood repercussions. The estimates now are we will see an increase in extreme poverty for the first time since 1998. And depending on your definition of poverty, what rate you look at, we're talking about several 100 million people that may be pushed back into poverty, again, for the first time in many, many years. So the challenges are both long-term health, but also long-term economic consequences. Maybe Amruta, I can turn to you. What are some of the stories that you are particularly looking at these days and particularly interested in? You're in a country that is now the second largest number of cases, known cases in the world, in India, and where the virus really is continuing to move.
Yeah, you're absolutely right, Raj. Like Gavin said, we're still grappling with this thing. As journalists, we're still trying to understand how things are evolving as we're reporting it on a daily basis. Here in India, things are moving really fast, and we just overcame Brazil in the highest number of cases. We might overcome the US in the next couple of weeks, and given the poor sense of health infrastructure and the fact that, like you were saying before, people are affected by non-COVID impacts as well. I think, this is something that I will be focusing on, and we will be focusing on at Devex going forward, just looking at, what it means for the people in these countries as we go on, and what that means for, health, but also economics, as you were saying.
Jenny, I read with interest your recent story about the Accelerator, which is an initiative led by the WHO to raise funds to make sure that there are diagnostics and therapeutics, and ultimately a vaccine for everyone, not just people who live in rich countries. I know that's a story you've been following as well as others. What are some of the things that you're paying attention to at this point in the pandemic?
Sure. Yes. So, the Accelerator is really meant to sort of make sure that we're speeding up the research and manufacturing of some of this global public goods that we're saying, and making sure that they're really global public goods, meaning that the financially capable countries are not the only ones benefiting from these products. It's a struggle really when you look at just looking at the funding. So the Accelerator is actually there are actually four pillars, but what we know of is the testing, the therapeutics, as well as the vaccines. And currently there's a huge focus on vaccine development. We've been seeing deals left and right, and one of the things that we're closely following on at Devex is really the COVAX facility, because prior to the pandemic, speaking with different experts, we really don't have any framework to ensure there's equitable access to low and middle income countries. And so we're looking at the COVAX facility and seeing, what's going on here. Are countries engaging with this facility? Are vaccine manufacturers sort of making deals with Gavi, that is co-leading this facility, and making sure that we have the doses that will be equitably given to different countries once a vaccine is available. Right now, we know deals left and right with the US and the UK. And
these are deals that ensure the vaccine's availability for citizens of those countries.
Yes,
right,
exactly.
And I've had a number of conversations, including some on the record video interviews with some leaders in global health. And this idea of vaccine nationalism isn't just kind of a worry of NGO advocates or something. This is a worry of real leaders at the biggest health institutions in the world who say it's real. The vaccine nationalism issue is real. It is in fact the likely scenario, and that if you want to avoid it and make sure there's equitable access, you've got to actually really step up from where we are today. It's a significant threat.
It's a really interesting challenge that the world has never faced anything like this before. There's so much complexity here. First, developing a vaccine in the speed that we are hoping to get it is unprecedented. And it's really exciting to see how people are working together to make that happen. So that's one challenge. And then when a vaccine's available, a lot of the vaccines are going to be targeted for very specific populations. So there's going to be some decision making that needs to be made around prioritizing within populations. And
you're
then
thinking there about healthcare workers maybe, or particularly vulnerable populations like elderly people.
Exactly. But a lot of times vaccines are really for certain populations. So if you're a healthcare worker and the first vaccine that's available is really efficacious for elderly people, that might be an interesting challenge. So you layer that on top of this competition that's going to exist that so many world leaders are trying to avoid with the ACT Accelerator, as Jenny was just explaining. It's going to be an enormous challenge. And the thing that everyone needs to keep front of mind is that vaccine nationalism at the end of the day doesn't help any of us, because if the US gets completely vaccinated, but Amrita's colleagues in India do not, we've done nothing to solve the problem. We cannot close global borders for a long-term way. It could maybe work for a very short term. So we have a lot of challenges ahead of us, and global solidarity is absolutely essential.
Yeah, one of the interviews that I did during this pandemic was with Peter Sands, who I've been talking to pretty regularly. He's the head of the Global Fund. And Peter said his nightmare scenario is that one day the Global Fund's name will have to change to the Global Fund to fight HIV, TB, malaria, and coronavirus. Because the reality is that if we don't get the vaccine everywhere, then this is a virus that will be with us for a very long time, and it may find a place in some of the lowest income countries. In fact, he points out HIV, malaria, and TB were global pandemics and still are, but if you look at where they're really endemic, it's largely low and middle income countries. So the same scenario could potentially play out with a more flu-like influenza or pandemic like the one we're seeing here with COVID-19. So there's real risk there. I do want to take a minute to talk about what we've been doing at DevX in terms of our journalism to try to cover this. So just taking everybody back to the very beginning of this situation. One of the first things we did, and Jenny, I think you were a big part of this, was creating this timeline. Maybe you can tell people what that timeline was, and it's still out there. Give them a sense of how it's done, what it's meant to the community.
DevX coverage of the pandemic really started right off the bat after the World Health Organization, alerted the world that there's this atypical pneumonia, they're calling it back then, coming from Wuhan, China. And in the days following that, there's just an explosion of news, explosion of information. And what we wanted to do, instead of coming out with these long form stories and just giving a very analysis of what's going on, we want to make sure that our readers also are up to date on what's going on, not only of what they can read from others, but also really what's being done by development organizations, tracking, where's the virus now going, where has it spread. And so if you look at the timeline, it's really, really long, but we've received really such great feedback. We've been receiving private messages and emails, even, people who did not know DevX before have started to read the timeline, read DevX, because they're looking at the international response and seeing that there's this really comprehensive timeline out there for that.
And that's one of the things we realized early on after putting it out there, was that there actually was a big appetite for the international story. So much of the COVID-19 response story was about what's happening, especially in the beginning, in northern Italy and in Spain and in the United States. And it really, a lot of the focus, because that is where a lot of the deaths and a lot of the cases were, especially in the early going, much of the journalism was focused on those countries, understandably to a degree. But we really haven't made up for that. Even at this point, there's not that much attention and focus on where most people in the world live. So we put out this timeline, which is kind of a running timeline of all the stories and updates, and it's graphical as well as having headlines you can click on. And very quickly, we found that millions of people around the world were Googling for timelines, and they were Googling for things like coronavirus timeline or international timeline for coronavirus. And the number one hit was the WHO, and the number two hit was DevX. And this timeline really took off. And it was a great way to get people to see the big picture. And we'll certainly link it through here with this video, because it's something you might want to take a look at even now as you see the numbers move for different countries, and as the story develops, it's kind of remarkable to go back and look at it. Amruta, so that was the kind of beginning of some of our coverage. What was some of the other things that we started to do and started to cover from there?
Right. So, as you know, our global team of reporters really got onto the story right in the beginning. And after we put the timeline out, we were thinking of what the repercussions might be on lower and middle income countries that we usually report on. So we started looking at, the African continent. We started looking at Southeast Asia and sort of mapping what might happen next. And, fortunately or unfortunately, I feel like our reporting rings true now. We're seeing a high number of cases in countries like Indonesia, where, we continue to track what's been happening in Africa. And, fortunately, there haven't been as many cases in Africa, but we've also tracked what's working and what's not working. And I think that's sort of been one of the major themes of our reporting, to look at various countries and what their responses have been like, and to say, okay, this is working here, and, what will it take for that to be implemented elsewhere. So recently, our colleague in East Africa did a story about South Africa. And, looking at community health workers, looking at what kind of lockdown measures were put in place, and to see if that can be, again, emulated elsewhere, and what that would take. So I think I'm really proud of our reporters for really digging deep into these solution-oriented stories, and really looking at, what hasn't been done before in the mainstream media, and in a way that can really benefit our audience and the practitioners who are on the ground right now.
The community health worker story is a really important one, because early on when we were covering this, the WHO wasn't yet including them in their calculations of who needed PPE, including things like masks. So, you know, in many countries, including in India, they were being sent door to door to do their typical health work, but without the proper protective equipment, which could be deadly to them, but also could be a vector for spreading the disease. So it was a big story to cover. You know, Gabrielle,
Raj,
one of the, yeah, go ahead.
I wanted to jump in on that.
Yeah.
You know, given my background in infectious diseases, obviously once this started, there was all sorts of things that needed to be done. And one of the initiatives that I've been a part of is the creation of what's called the COVID-19 Action Fund for Africa. And what that does is trying to solve that exact problem that you just talked about is, you know, there's a challenge in many countries of getting PPE and the supplies that are needed to even the frontline health workers. But even if that challenge is solved, you get to the community health workers who are essential for delivering care, and they're in the most local communities. But they were not, as you said, included in those calculations. So we set up a fund to work with philanthropists to collect contributions to get them delivered to the last mile in a number of countries in Africa.
Yeah, and that is a big part of what you do and what you know a lot about. And I want to come to you on that because part of the lens of our coverage, which is a little bit unique, is that we're looking at the institutions in development. You know, we're covering the World Bank or USAID. We broke this big story about how there is a potential for a pandemic response organization to be set up within the State Department. You know, the institutions are particularly important. You see that now during a crisis like this, because sometimes it's about creating new institutions, funds like the one you described, the ACT Accelerator, or it's about existing institutions kind of standing up and doing something new and bigger and bolder than they might otherwise do. And I wonder what your take is on that, Gabrielle. Maybe you can kind of help give us a sense of where these big institutions, the acronyms we all know, like where do they fit into something like a global pandemic?
Yeah, well, I mean, I think we're seeing the importance of these institutions. You know, after every pandemic or epidemic the world has had, there are always reports and commissions talking about what needs to change. And following the West Africa Ebola outbreak, there was a lot of criticism of the WHO and things that needed to be done differently. And they really took a lot of those recommendations to heart. And we have a very different WHO health emergencies program than we did just a few years ago. So that's one area that's really been strengthened. There was the creation of the Coalition for Epidemic Preparedness Innovations, or CEPI, that didn't exist until 5 years ago. And that, if that didn't exist, we'd be creating it from scratch. So that's the good side of this story. There was also many recommendations that were made that were not taken, and we're paying for those now. And, you know, we're starting to see panels and commissions come out with a new set of recommendations, a number of which have been made in the past. In the pandemic world, there's this phrase called the cycle of panic and neglect. And, you know, we're in a bit of the panic now. And I'm not sure we're going to be able to even get to the cycle of neglect for quite some time because we still have so much to do. To answer your question, the global institutions are absolutely critical, and the improvements and the new ones that have been brought to bear are important. There's even more that needs to be done. And that brings me to something I also wanted to mention, the Pandemic Action Network, which is another initiative I'm part of. And so we just talked about the big institutions, and they have a critical role to play, but there's so many other stakeholders in this. The Pandemic Action Network is a network of a lot of those stakeholders. So the big institutions come to the table, but we also have private sector companies and advocacy organizations and philanthropic organizations that are all coming together saying, okay, if we want something like the ACT Accelerator to be funded, how do we use all the tools in our toolkit to try and get awareness of that, raise money in new and unique ways? And these types of massive global problems can only be done in partnership. And you need the big institutions you were just talking about, but you need all sorts of other types of influencers to make change happen.
Yeah, and it can seem a little bit like controlled chaos, you know, in a moment like this where you have, there are so many conference calls going on with advocates and funders and implementers. There's so many Zoom calls, there's millions of them, right? And people have different priorities and they're trying to organize different things. And the important a key important thing is to make sure that the biggest issues, the most important issues, stay at the top, that they get real attention, that there's some real accountability around them. And I think that's where the journalism that we do comes in, is we try to raise the profile of these issues, but make sure there's really some accountability to see, are we getting there? And I mentioned at the very beginning that we were going to have a little bit of an announcement here, and I want to get to that now, because a lot of the journalism you've heard about that we've been doing for 6 months now, and some that we haven't even mentioned yet. We had, for example, a tracker poll where we've been interviewing thousands and thousands of global health workers, NGO leaders, and others to find out, what does this mean for your organization, institution, and tracking that. People losing their jobs, organizations getting more funding or losing their funding. That's one of the key things we've been providing. We've had a visualization on trying to gather all of the funding announcements around coronavirus response, so we can track it, both so organizations can try to access that funding, but also for accountability to see who's pledging, but maybe not following through. So all of this and all the other journalism we've been doing would not have been possible in a normal scenario for us at Devex, because like most news organizations, we've got lean budgets, we have a subscription model. And so we thought we got to do something different. It's a pandemic, it's a different moment. And we came to you exactly as you said, Gabby, around the idea of partnership, and said, how do we partner to do something a little bit different? And what we have stood up that we're announcing today is this global COVID-19 Journalism Initiative, which is a not-for-profit initiative that's a partnership between Panorama and DevX. And we are really honored and excited to say we've already gotten funding for this from the Hilton Foundation and the Open Society Foundation. And we are looking actively for other funding, and it's essentially allowed us to have this global coverage of the coronavirus pandemic and response, and to do it totally free. So all the content we just talked about is not behind our paywall, it's completely free. And it's a far higher volume of content than we could otherwise have produced. And it's also really rich and deep in many ways, including things like visualizations and data resources and things that we normally might not have been able to do, but for a special initiative and partnership like this. So I want to thank you for that partnership, Gabrielle, and just ask you to chime in as well on what we're doing together.
Yeah, well, we're thrilled to partner with you and the team at DevX. So I've been a longtime fan of DevX. I remember when it started, and I believe this is your 20th anniversary, so congratulations. And it's really amazing to see the innovative and entrepreneurial approach you've taken to delivering news. You know, as someone who has long been in the global health and development fields, there is so much going on, and there are so many stories. And I feel like a lot of that wasn't even being exposed. As you said, you're breaking stories. And so that type of entrepreneurial approach to the news business is something we're so pleased to support. And just to explain the partnership, there's something that's called fiscal sponsorship, and Panorama is pleased to be the fiscal sponsor of DevX. And that allows DevX to keep doing the great journalism they're doing, and it allows us to provide the back-end support for you to receive philanthropic funding. So really pleased to partner with you on that.
Thank you. Yeah, it's been a great partnership so far. We're excited to announce this to everyone here. And we wanted to do it in this format so we could really talk about what are some of the stories and issues that we are covering through this initiative and why it matters so much. So let me just go back to Amruta and Jenny. You know, looking forward, we talked a little bit about where we are. How do you see the story developing? What are some of the things we're going to be paying attention to going forward together?
Yeah,
Amruta,
for sure.
yeah,
I think going forward, again, like this is not ending anytime soon. And I think at Devex, we're ready. We know, what we want to cover and what our audience needs. I think for me, what would be priority is looking at, like we just talked about, vaccines, looking at how they're being developed. So really looking into these details and looking at, how things are working, and really holding people and organizations accountable to the things that they have promised. Looking at funding, like you mentioned, we have great visualizations going out every week to look at what the newest funding has been. And our colleague in Australia, Lisa Cornish, has really been on the top of this. So, really, we want to explore more of that as well. Looking at what are the, different sectors that funding is going into, but also, where it's not going and how those sectors are getting ignored. And that will feed into our reporting as well, looking at, what needs to be done and where those gaps are. So I think going forward, we'll be focusing on COVID and its impact, obviously, but we're also not going to ignore what that has left behind for diseases like TB and malaria and maternal health, and what that means really, again, coming down to the people that it affects.
We talked a little bit about Ebola earlier, and in fact, during that crisis in West Africa, many more people died from everything else than died from Ebola because of lack of access to the healthcare system, because of poverty and increased poverty during that period. So you're right, this is a systemic issue, particularly for the most fragile countries and the most fragile and vulnerable populations. All of these things are connected. Jenny, what are you looking forward to covering?
So just supporting what Amruta said as well, we're continuing to cover COVID in countries, as well as having that global perspective, but also the impacts of it, like for instance, on global health, the impacts of it and other diseases. We've really covered a lot on the impact on HIV, TB, malaria. I just recently spoke to Michelle Zafran, who's the WHO director for polio. And, we don't talk about polio a lot these days, but, they're looking at a 2021 where they're going to have financial challenges. And some of the billions of pledges that, were announced in 2019 for polio, there's just a very small percentage of that has come through by this point. So, I think we'll continue to cover these things also because, there's so much focus on COVID, but we shouldn't be forgetting, all of these other issues, but also other things that don't get as much headlines today in a lot of reporting. I know we've spoken a lot about vaccines, but we shouldn't forget about diagnostic testing as well, and how much of the $2 billion that's immediately needed is actually, there's just about, I think, 250 million available at the moment. And you see that, they're having challenges as well in securing supply, for instance, for rapid diagnostic testing, which is where we all wanted to have to ensure that there's a ramp up in testing. But, we've also seen we're seeing similar patterns with vaccine where financially capable countries are getting, advanced deals on this product. So we'll definitely continue to be covering these issues.
I appreciate that very much. And I think it's time to wrap up the discussion, but I want to say that, everything you all talked about just shows us how urgent these stories still are. And that for much of the world, this is going to be an ongoing story. And it will shape a lot of what we all do in global health and in global development. Whether or not you're working on the coronavirus, this is going to be a big story because it affects how all of these organizations work, how they get funded, and so many other issues, polio being a great example. So I just want to say again to the Open Society Foundations, the Hilton Foundation, a big thank you for supporting this initiative between Panorama and Devex, supporting this journalism. To all of you who are watching this, who are regular Devex readers, we need your input and your feedback. We appreciate that very much. So find us on social and continue the conversation. And all the content we just talked about exists on our single page at Devex, all about COVID. You can go there and find all of this. And again, it's all totally free. So we really appreciate the support that makes that happen. Gabrielle, thank you for the partnership.
Thank you. And thanks for all the amazing reporting you're doing on a daily basis.
Thank you. All right. Thanks, everyone, and be well.